Hello, I'm Deborah Pascali-Panaro of Orgasmic Birth and having a really pleasurable conversation. I hope you'll see our prior videos today with Dr. Sarah Buckley and share again a little bit about your work and your websites.
So I'm a family physician or GP by training. I'm the mother of 4 children, all born at home, and also the author of the book Gentle Birth, Gentle Mothering. And I have a special interest in the hormones of labour and birth. I'm the author of the 2015 report Hormonal Physiology of Childbearing, and it's a great pleasure to be with Deborah, the Orgasmic Birth Queen, and talk about the hormones of labour and birth, pleasure, and how to create pleasure, how to fill in the hormonal gaps in any situation in labour and birth.
Yeah, so we're in Bali, you probably can see around us, and this morning we were talking about an issue that we're really seeing a lot around the world. I had a text from one of the doulas that I've worked with talking about being with a family member who just very quickly had a lot of interventions, many of which sounded like they weren't needed. They were really enhanced by a lot of scare instead of care, but the end result was a cesarean birth, a belly birth, and this is becoming epidemic today. So I wanted for you to share a little bit with everybody about how that belly birth, plays with the hormonal physiology, and then suggestions on how we can help close the gap, because there are times that it's life-saving and truly a benefit for MotherBaby, and sometimes it's hard for people to know when it's overuse and when it's appropriate use.
Yes, so definitely every intervention has its place, and as you say, can be life-saving for mothers and babies, but from a hormonal perspective, the problem is they can cause a hormonal gap. And of course, the biggest hormonal gap we're going to get is with a pre-labor cesarean, where there's been not the full preparation for labor and birth for mother and baby, and then neither of them have experienced the hormonal benefits of labor. And these include not just oxytocin, I'll refer you to our previous videos, but for the baby, the processes of labor and birth activate adrenaline and noradrenaline, the catecholamines, also called epinephrine, norepinephrine. So the baby at the end of labor gets this huge catecholamine surge, extremely high levels of adrenaline, noradrenaline. And you could say that it wakes up the baby on every level to prepare them for this massive transition to life outside the womb. So this catecholamine surge happens as the baby's moving down low, the pressure on the head, the lack of oxygen, which, as I say, is inevitable for every mammal getting out of the womb. There's always going to be some lack of oxygen, but Mother Nature has all these safety systems, and one of them is this catecholamine surge. So it actually protects the baby from those long, strong, close together contractions. They're inevitable as the baby's pushed out. It also prepares the baby for breathing on lots of levels. It clears the fluid from the lungs, it opens up the airways, increases the lung lubricant surfactant, and also improves the baby's metabolism as it's going into life outside the womb, where there's no delivery of metabolic fuels, glucose that comes through the placenta. The baby's going to have to do that themselves. So again, the preparation for life outside the womb through the activation of the baby's own fuel metabolism. It also helps the baby to start to create its own heat by burning the brown fat between the shoulder blades. So catecholamine surge is really important for babies to make that transition. And the problem with the pre-labor cesarean is that the baby doesn't have any of that preparation. So the pre-labor cesarean baby often has those kind of difficulties, breathing difficulties. The baby gets low blood sugar, hypoglycemia. The baby can get cold as well. So quite a big hormonal gap in relation to the baby. And of course, for the mother, none of the pre-labor preparations, none of the in-labor processes, a big gap in oxytocin in particular. So, the gaps are very large, yeah.
So would you recommend for people that for medical reason or whatever reason are scheduling a cesarean without labor, could they in fact wait to go into labor and still have that cesarean if needed?
Well, from a hormonal perspective, that is an ideal solution, because not only do mother and baby experience at least some of labor, but when the baby initiates labor, as we understand it, the baby is signaling their readiness for life outside the womb. So we know that the baby has all that readiness, and the mother also has that readiness, because chemical signals, hormonal signals pass between mother and baby through the placenta that make sure both are at the peak of readiness at that magical moment of the initiation of physiological labor and birth. So they've had all those pre-labor preparations, they've had some labor and birth, and there's quite a few studies showing that those are beneficial for mothers and babies. A little bit harder to organize, but really an ideal cesarean is one with an in-labor non-emergency cesarean.
Okay. And for those that are in labor and the decision is made to move on to that cesarean, or as we're starting to say, belly birth, what would be some of the ways they could help close that hormonal gap in the best way, either during the process or after?
So the most important thing in terms of filling that hormonal gap, well, two things really, is skin to skin and breastfeeding, because skin to skin between mother and baby triggers oxytocin release for both, switches off the stress systems for both, switches on the calm and connection system, and then breastfeeding also, I call it Mother Nature's backup system. So every time mother and baby breastfeed, they're getting oxytocin, endorphins, prolactin, and the stress levels are going down. And the important thing with the cesarean is it happens as soon as possible after the birth. So the ideal cesarean is a natural cesarean, and I'm going to refer you to my website and my blog, how to have the best cesarean. There's actually some links there to the natural cesarean paper. So, you know, it can be arranged. You'll see some videos there where the baby is born, can actually wiggle itself out of the womb, even when it's a belly birth, come up onto the mother's chest, skin to skin, no separation between mother and baby, an ideal scenario. And of course, because the baby hasn't had the full preparation, the full catecholamine surge, the baby's going to be a little bit drowsy, going to take a bit longer to wake up. The mother may be impacted by drugs. So, you know, a lot of patience there, and letting the baby be skin to skin to recover and to reduce those stress levels.
So important. And I'm attending some really gentle belly births in my community where we're even delaying cutting the cord 2 to 3 minutes.
Yeah.
We're keeping mother baby together all the time, and any care can be done on them. You know, we're seeing the pediatricians right there and caring for them as a unit. And the other beautiful thing that our midwives do is when the head is emerging, and as you say, right, they're really allowing it to come out gently. We lower the drape so mom can actually look down and watch her baby being born. But the midwife whispers to them, push your baby out. And just kind of those simple words change the whole process from one that's done to you to one that you're a part of.
Beautiful.
So I think we have so much we can learn, right, in how we perform cesareans when needed, but also reduce them when they're not.
Exactly. Thank you.
Thank you. And for those listening here, please, we love to hear from you. Let us know if you've had a natural or gentle belly birth and suggestions that you might have on how we can help close the hormonal physiology gap even when interventions are needed. Thank you.
Thank you.
Ring the bell and subscribe for more orgasmic birth content so you can positively prepare for birth and parenting. And follow us on Instagram at Orgasmic Birth. And if you'd like some extra surprises, go to orgasmicbirth.com.